come in.
Hi, Mrs. Osborne. My name's Tori, and I'm with the Respiratory Care Department. And I'm here today because your doctor has ordered you to have an arterial blood sample drawn. Okay?
Okay.
So what this means is that I'm going to draw blood from your arteries instead of your veins, which is probably what you're used to. And by drawing this blood from your arteries, we're going to be able to see how much oxygen you have in your blood, as well as how much carbon dioxide you may be retaining. Okay?
Okay.
So the results of this sample are going to tell us what's going on, and that's going to help us so that we can help you breathe better.
Good.
Okay.
Good.
So that's okay? We can go ahead and
Yes.
do the draw?
Yes.
Can you verify your full name and birth date for me?
My name is Wyona M. Osborne, and my birth date is the first month of 26 to 35.
All right, Mrs. Osborne, I just want to quickly check your chart to make sure we've got everything we need here. Make sure there's no pertinent information I need to be sure of here. All right, so I'm going to go ahead and wash my hands here. And I'm going to have you go ahead and lay both wrists out like this for me. I need to be able to determine which radial artery has the best pulse. So I think this has got the best pulse. You can have that arm back.
Okay.
Now what I'm going to do is called the Allen's test. So when we perform the Allen's test, we're making sure that you have enough blood flow for us to do this blood draw, okay?
All right.
All right, so I'm going to go ahead and occlude your ulnar and your radial arteries here, and I want you to open and close your fist 3 times. 1, 2, 3. Now I'm going to let go of your ulnar artery, and we've got the color rush back to your hands. So that tells me that you have good enough blood flow for us to do this procedure, okay?
Okay.
Okay, so I'm going to go ahead and wash up here one more time and apply a glove. All right. And I'm kind of going to set your wrist up like this, palm side up. And I'm going to use my alcohol prep pad here to disinfect the area using a circular motion. I'm also going to clean the fingertips on my gloves where I'm palpating so that we're getting a clean poke here. All right. So I'm going to go ahead and loosen my cap on my needle. Okay. And I'm going to palpate for you the pulse. Okay. Right there, you've got a nice strong pulse. Okay, now I'm going to make sure that first I have to make sure that the plunger's drawn back so I have the amount of blood that I need. And then finding that pulse one more time. Holding the needle at a 45-degree angle like a pencil with the beveled side up, we're going to go ahead and poke. Okay, I didn't get it that time, so I'm just going to readjust without bringing it through the skin. And there we got it. So we're going to let that blood flow into the needle. And now that we have a full syringe, I'm going to use the gauze to apply pressure, and I'm going to remove the needle, and I'm going to use this self-sheathing needle so that nobody gets poked, and set that off to the side. I'm going to hold pressure on the wound for 3 to 5 minutes or until the bleeding stops. And I'm just going to examine the area for any redness, swelling, excessive bleeding, and then I'm going to apply the Band-Aid. All right, so then we're all done with that, Mrs. Osborne. I'm taking the sample here and I'm going to lock it into this, and then I'm going to use the plunger to push just a little bit up so that the air that could have been in the sample will be removed. I'm going to attach the filled out label, and it's going to go into this biohazard bag, which is going to be sent to the lab. Then I'm going to take all of my sharps, and they're going to be placed into the sharps container, and clean up my area, disinfect the area, remove the gloves, and wash my hands. Now, are you comfortable? Is there anything that I can get for you right now?
Oh, no, I'm fine.
Do you have any questions about what we did today?
Nope, I watched you all.
All right, thank you very much.
You're welcome.